Okay, well, I have it's about 12:30 on my clock, so I'm going to get started. Welcome to the Minnesota WIC Participant-Centered Webinar Series. My name is Karen, and I'll be facilitating the webinar today. I'm with Altarum Institute, a nonprofit healthcare research and consulting organization, and many of you may remember me from some trainings my coworker Bernadette and I did a couple of years back. And looking at the registration list, I saw many familiar names. So during this next year, there'll be 3 of these one-hour webinars geared towards leadership staff, so coordinators, managers, supervisors, mentors. And the goal of these webinars is to share ideas, best practices around PCS leadership. Joining me today is my colleague Marcus, and he's going to be doing the behind-the-scenes work of monitoring the phone lines and making sure things run smoothly. We did a survey a while back, and we asked you about the topic areas you'd like to cover during this webinar series. And one of the most popular topic areas selected by leadership was building successful teams. So that will be our topic today. So for this particular topic, what we did is we sent out a survey where we asked you for your ideas around team building. And you may have or have not received this survey depending on when you registered. And what the survey asked about was your challenges, your suggestions, your strategies for building successful teams. We got many, many great ideas, and I want to thank all of you that responded. And this is what we're going to be sharing today. We'll do this sort of short survey before each webinar, so I ask you to continue to help us with these. I think it's going to make webinars great if we can share our best practices with each other. I've also collected some tips and strategies as part of my role. I get to go out and watch agency teams in action, whether it's part of a national study or an assessment process, and I'm learning about what works and sometimes about what doesn't work in terms of team building. So I'll share that during the webinars as well. So to give you an overview of 4 key areas that we'll touch on today, we'll talk about leadership, an essential ingredient to any team. We're going to talk about creating a vision, empowering team members, and team building. So we will get started. So if you closed your eyes and dreamt about the perfect, most successful team, what would you see? Well, here are some of the possible things that you might see. Positive communication. No fighting. Work is a pleasant place to be. There's an open dialogue, a free exchange of ideas. There's an atmosphere of collaboration, cooperation, people stepping in to help others for the good of the team whenever they can. There's an environment of learning and risk-taking. It's interesting, this shift to participant-centered services and counseling, although it represents core and simple principles, it's often difficult for people to make the shift to participant-centered services, especially if they've been in WIC a long time. It's a process that takes ongoing support and training and risk-taking on the part of the WIC staff. And taking risks and practicing new skills, it takes confidence. So this environment of learning and growth supports this confidence. Strong leadership. We'll talk about this a lot today because you can't have strong teams without strong leaders. And this is what I've seen time and time again, that strong leadership is so important. And successful teams is an empowered team with staff members who aren't afraid to make decisions, to try new things, to lead their coworkers. So that's really what we want to see. You may see your team in a lot of these. Maybe there are 1 or 2 areas where there is potential for growth within your team. So today we're going to be looking at your suggestions around how to get to this vision. We asked you on the survey to describe challenges for building successful teams. And most of the answers provided fell into a few major themes. The most frequent answer on the survey was different personalities, personality clashes. This would include cultural issues, communication styles, work ethics, negative personalities, work speeds. work speeds is interesting. I often wonder, in some agencies I go to, I hear complaints like, I see so many more people than she does, and it's unfair. And I often wonder, why does that go on in some agencies and not others when the caseload challenges are the same throughout WIC? So it's interesting. And as a leader, managing different personalities and people with different backgrounds and belief systems will always be a challenge. Some people are open to change where others fear it. So another challenge could be miscommunication, people not being on the same page. And this could have to do with differences in vision. Does everyone on the team share the mission, the purpose, the vision of what participant-centered WIC services is all about? This challenge could be more acute in the agencies where WIC services are only a portion of their job. Establishing buy-in was also listed as a challenge, so that buy-in of we're all in this together, working towards shared goals that we all believe in. Time for all those things that help build a successful team. Time for team building, training, planning, rapport building. This could be a challenge when staff is spread out at different locations. It can further complicate this face time for team building. So one of the first concepts I want to touch on is that our belief systems impact our actions. And I see this time and time again in WIC staff and in leaders that our attitudes about our role and about other people really matter. I'm going to tell you a story of a recent assessment I was on, and this is an example of how attitudes of WIC counselors can impact their actions during WIC sessions. I was getting ready to observe a woman, a nutritionist at this point, and she stopped outside her office and pulled me aside. And she said, I want to tell you a couple things. She said, first, I want you to know that there's not enough time to spend, we don't get enough time to spend with each participant. Now, this is nothing new for you all. Limited time is a factor that we all have to deal with in WIC. And she went on, she said, also, participants aren't interested in changing their behavior or doing anything different anyway. She said, I give them the facts, but they don't care. And that was her belief, that people don't have motivations to adopt healthy behaviors. And when I observed her, I think that that belief impacted her interaction. She didn't engage. She didn't try to evoke motivation from the participant. She simply asked the questions and gave the nutritional information. So as leaders, building an engaged and empowered staff can be impacted by our beliefs about their capacity for motivation and for growth. With participant-centered nutrition counseling, we hold an optimistic belief. We believe that most participants have motivation. And I think we can also use the same belief system with staff, assuming that all people have motivations to do their best, to be their best self. Now, they may have gotten stymied along the way. Like participants, they might not have been able to connect their hopes and their motivation to goal setting to actually make those hopes a reality. They might not have been taught how to express their wants or needs in a constructive, positive way, and fears often come out as negativity or resistance. So perhaps the employees weren't given the tools early on to know how to work effectively as a team, but we come from that place of optimism, that the desire is there, the desire to be part of something successful and meaningful. And what we have to do is evoke those desires and give them the tools to make it happen. I was reading a book by Deepak Chopra recently, and this quote to me illustrates the point that often fears come out in different ways, and people might not have a history of knowing and asking what they need in a constructive way. So the quote says, people don't wear signs announcing what they need. Quite the opposite. The chronic complainer may actually be afraid of losing his job. His need is for security. The outspoken critic of new ideas may feel left out. Her need is for nurturing. So if some of us might not have been trained or supported to share our needs and our hopes in a positive way, it can often be confusing for leaders who have to read those signs. In the evolution of PCS leadership style, it's mirroring the evolution in behavior change that's going on at the local level in public health. Because we are talking about behaviors. It may be different behaviors with participants who are talking about them adopting healthy nutrition-related behaviors, With staff, we're talking about them adopting healthy and positive work-related and participant-centered behaviors. But the same behavioral principles and theories apply. So first, the style it's a strength-based style instead of a deficit. So we're not looking only for those risks. It's a shift from focusing on the negatives, the deficiencies, or what people are doing wrong and telling them how to do it right. Instead, we're shifting to focusing on strengths, building confidence, exploring people's inner motivation to change, and then creating a partnership to help guide staff based on their unique needs and circumstances. It's engaging them in the solution, less telling and more asking. It's the same motivational style of guiding that's used in counseling. It's interesting. I watched a YouTube recently, and the speaker said, often people shy away from the term leader, like it's bigger than us. We don't give ourselves credit or feel good about our role. We need to own and value the positive impact that we have on others as leaders. The speaker said, it's not about changing the world. It's about changing one person's understanding about how powerful an agent of change they can be. And that's empowerment, and that's the word I think about when I think about the shift in style to PCS leadership. So we want to explore, what does it mean to be a leader? What characteristics do we want to have? And this is what you said on the survey. And this list is really a mixture of characteristics and actions. Flexibility was the #1 response. And this goes back also to the biggest challenge you noted was those different personalities. To lead so many different people and to work with so many different types of participants and in so many different types of agencies, flexibility is so important. Being authentic, being open and honest. Trust. And the message here was trust in your staff, having that ability. Being positive. Communication skills, listening to your team, using communication skills that staff are using with participants. Being patient, inclusive, involving all staff in the process, in the planning, in the outcomes. So some characteristics of effective leaders. One of the most important aspects of leadership is your role as a vision keeper. The biggest driving force of growth is motivation. So we need to think, why are we doing something? What are we trying to achieve? What's the vision? Otherwise, we get bogged down in the day-to-day without purpose. Especially with the PCS initiative, our goal is to become more effective at helping families adopt healthy behaviors that we know are going to lead to those positive health outcomes. But it's not always an easy recipe. It's not black and white, install this software, follow these steps. There's training to be done. There's untraining to be done. We've learned that telling people what they're doing is wrong and how to fix it isn't effective, so we're learning a roadmap on how to do it more effectively. So we have to take something that's in a way complicated and yet profoundly simple, but we have to package it in a definable vision that helps local agencies and helps local staff keep moving towards that goal. We have to be able to communicate that vision to staff and upwards to agency and to other people as well. One of you said in the survey, create a vision that each individual can understand and can personally connect with. This will give buy-in to the vision or goal and make it successful. Here's a quote from the Dalai Lama. He said, in order to carry a positive action, we must develop here a positive vision. So by interpreting the vision, we translate it into action. So everything we do and how we interact, communicate, set policy, mentor, is guided by the shared vision that we all have. This vision should incorporate what being participant-centered means to you and your agency. Possible things to think about including in your vision might be, where do you want your focus to be? A lot of people think about balance, focusing on caseload or quality. Staff get confused here and get different messages because often as leaders, We strive for one, but we might get judged on the other. So our role as a leader might be to make that clear for staff where they should focus. The focus on building the best system possible, and that caseload will come. Maybe part of your vision is around quantity and length of sessions. Sometimes there's an anxiety there for staff. The belief system that PCS visits take longer. Maybe part of the vision is a belief system that quality, influential encounters don't have to be long. They can often be short and powerful. Over the years, I've been to several Minnesota WIC sites, and I went to one where I saw probably the shortest additional ed sessions I've ever seen. And you know what? They were some of the best I've ever seen. They were short, focused, prioritized, motivational, action-oriented. So you can decide what you want your shared vision to be and what is going to drive your actions. And we can involve the team in the process of creating this vision. One person wrote on the survey, gather input from all on a vision and when developing related activities. Being deliberate to establish clear goals and expect contributions from all the team. The more staff have input into the plan, the more they buy in and have ownership, and the more likely it is that goals get met. And so you can see the parallels to nutrition counseling almost at every stage. So in looking at creating a shared vision, what do we want to communicate? We want to ask ourselves some questions about the vision. And some questions can be, is the vision clear? Is it simple so everyone can understand it? Is the vision verbalized often, every chance we get? We sometimes make assumptions that people share my vision, that they understand. And if I told them once, we assume that they processed it internally. But what I'm learning is that this isn't always the case. I'll give you an example. We did a pilot program recently, as we did with your state way back, and we did a survey at the beginning and the end. And we wanted to see changes, any changes in beliefs, attitudes, and confidence. And one question, we asked if they agreed or disagreed with this statement. I have to provide education on every risk factor identified. And on the pre-survey, 70% of staff agreed with this statement. Even leaders, coordinators, and the state staff was really blown away. They said, but we've been saying that for years, that that's not the case. So in the initial training we did for this pilot, we said it plainly and clearly, you do not have to provide education on every risk factor. And we said it a few different ways. And after the pilot, we did the same survey. And although the number went down, still more than half agreed with that statement, I have to provide education on every risk factor identified. So visions often take repeating. And then we want to ask ourselves, is the vision reinforced with actions in all that we do, evaluations, training, mentoring, policy, setting procedures? And then we want to ask, is messaging consistent so they're not receiving mixed messages? I'll give you another example from my experience. I was working with a WIC director to implement a mentoring system for staff development. And when I talked to her, she said, we're going to have one staff member do mentoring, but someone has to tell them when they're doing something wrong, and that's where I come in with my evaluation. And I knew before we even got started that this staff is probably going to be receiving some mixed messages about the vision and goal of what we're trying to achieve. So some things we need to think about when creating our shared vision. So now we're going to switch up and talk about empowering individuals within the team and the team as a whole. So wouldn't it be great to come in every morning and see this from your team? On this slide it says setting expectations for performance. One person on the survey said, be as transparent as possible with expectations for performance. So why do we set expectations? Well, one reason is that it prevents confusion about what is expected overall and for individual projects. And this confusion creates anxiety and frustration, and that anxiety and frustration often manifests in resistance and failed performance. So some things to think about when you're setting expectations is to plan expectations. It first requires you to think and plan. What do you want or expect from the team or from individuals? You have to first get clear before you bring others into the conversation. Things to think about is what is within their scope of work and what isn't. What are your expectations around communication? When do you need to be brought into the loop and when you don't? Thinking about what decisions they can make on their own, how much freedom do they have to make things happen for participants to solve problems, even if it means tweaking a procedure or a process to make that happen. And I see differences here in agencies, and we all have different comfort levels, and that's okay. We want to, when setting expectations, state them clearly. We make assumptions that people know what's natural or expected in a workplace and how to act in a team, but it's not necessarily the case. People have different backgrounds. You want to write expectations down, get agreement, get commitment, and confirm understanding. You want to repeat them frequently. Don't assume that if you tell someone something once that it will stick. It might take several times before it's internalized. Thinking about managing expectations, it helps to be outcome-oriented. So let people know what outcome you want and look for those areas where you can be flexible in the process or how they get there. And that gives them the empowerment to think for themselves and to learn how to make decisions. From my experience, successful leaders, they often do more with less. So can I think about the maximum and give the maximum amount of choice and flexibility within any given situation to allow staff to make the best choices for that participant? I'm going to give you an example, and this is an example about nutrition education and counseling. So the state has guidelines, and often local agencies have guidelines and expectations as well. And the thing to look at is, are these guidelines working for you? Are they getting you what you want? I went to an agency recently in another state where I sat in on nutrition education sessions, and I was just overwhelmed with the number of nutrition messages that participants were given. And I could tell the participants were overwhelmed as well. So I asked the counselors, and it turns out that they're required to cover all those points with each participant. And I know that some things have to be required. We can't get around that. But within that, can we give the maximum amount of flexibility we can? In this case, the policy was designed for a good reason. It was designed to help ensure that each participant was given the same information, the same quality of information. But what it did is produced a system where staff aren't allowed to tailor and create an appointment that's meaningful to that individual. So focusing on the outcome and not the process, it also helps us avoid that micromanaging syndrome. When leaders try to micromanage all the details within their sphere, a couple of things happen. One is that it's exhausting and they burn out. Another thing is that you're not teaching others how to do it. And they get used to not making decisions or having power, and it becomes the norm. Now, as people grow and learn how to make decisions, you can always let them know that if they get stuck or if they have questions about the best process to take, that you're there. And some people might need more support as they learn, and some might need less. And so another thing with setting expectations, one more thing I want to mention is giving and receiving feedback. Many programs have individual goals as part of their evaluation process. That's great. And thinking about some agencies even have a goal related to quality or a PCS goal to work towards. And we say receiving feedback, and sometimes that's tricky. Can you seek and accept feedback without defensiveness as a leader, which can often be difficult, but it can build trust and relationships within the team. So a lot of you on the survey talked about evoking individual strengths in staff, and I'm going to read some of the responses for you. I believe in giving small additional responsibilities or roles to staff, which makes them feel a part of the team. Be knowledgeable on individual strengths. Acknowledge and respect them. See the strengths in each staff member. Include staff members. Get input from them. Need to continuously build teams and cultivate leaders within the team. So finding individual strengths. Where are people's passion? If people are doing something that they enjoy, they're going to come to work more engaged. There'll be less turnover. And one way to find out interests and strengths is to ask people, what are they interested in? Are they interested in clinic environment? And can we give them a role in that? Are they interested in the artwork, the posters, maybe the videos that are playing in the clinic environment? Are they interested in staff development? Maybe they can be involved in training or coming up with activities for staff or facilitating discussions. Maybe their interest is in process, in flow, reducing wait time for participants, improving efficiencies in the office. What can they do to be involved there? Or maybe they're involved in improving other services for participants, like grocery store tours or community gardens or group education or healthy weight classes, things like that. So can there be other things, give people additional roles? Because as they become invested in the outcomes, this is where we're going to see more success. And it's interesting, one of the last quote talks about cultivating leaders at sites, and I think that's an important part of leadership, is building other leaders within the team. And one idea here, I know that some of you have implemented a system of mentoring within the program, and the role of mentor is a strong way to encourage leadership within the program. This quote says, "The deepest principle of human nature is the craving to be appreciated." William James. So think about, when was the last time you were affirmed at work? Was it a long time ago? Was it recently? How were you affirmed? And then how did it make you feel? Did it change anything about you or the way you worked? Mentoring is so important. Affirmations and mentoring. Affirmations build motivation for behavior. Affirmations help people change their vision of themselves and empowers them to grow. It lets people take risks and feel safe to go outside that box. It's interesting that most people don't leave jobs because of money. They leave because of lack of recognition. That's the top reason why most people leave their jobs. Here's a quote from Molly Kellogg, a nutrition counseling expert. I know that you're all aware of Molly Kellogg. And she said, "Affirmation consists of the overall view we take of others. We search for what is right rather than what is wrong. We notice efforts being made, even if small. This encourages more small steps that lead to real changes. When we tune into strengths this person has, we support them in their confidence on this journey towards health." Now, she was talking about the relationship with participants, but we can extrapolate that to staff as well. She also said that you have to position yourself to consciously search for those efforts and strengths so that they pop out at you easily. It's something we have to train ourselves to consciously do, to look for strengths. And it's easy to get off track here with this element. And this again mirrors what we're doing in nutrition counseling. The nutrition assessment process encourages us to focus on what's wrong sometimes, what's missing. And it takes commitment to focus on the client's efforts, their strengths, their interests. And the same holds true for leadership. So helping others get in the habit of affirming themselves can be important. This slide says, in an affirmative spirit, you also support others to affirm themselves, especially if they don't do it easily. Reflecting efforts and strengths as you notice them encourages them to notice them too and to voice them more often. So you're helping people get in the habit of affirming themselves and having that confidence. And I also want you to look at yourself. Do you affirm yourself? Do you have positive self-talk? Because this will impact how likely you are to give affirmations and how well you do it for others. Now we're going to shift to talking about your suggestions for building strong WIC teams. So here are some characteristics of strong teams. Focusing on the why, the clarity of purpose, embracing that vision. Strong teams share resources, physical and emotional, ideas. So emotional resources can be more than just physical. It could be suggestions. It could be encouragement. It could be enthusiasm. So different resources. Strong teams communicate effectively. They use those communication skills with each other and not just participants. They have well-defined goals, which takes planning time, but it's also so important. Do you have an ongoing work plan for program improvements that you refer to and update on a regular basis? Are your goals written down? Goals are so important. They help us achieve more than when we don't have them. And it's mirroring that work that we do with participants. Having a work plan and goal creates that air of constantly moving forward. So some strategies for team building. These are the ideas that you gave. Having staff meetings and regular staff meetings. Discussing participant situations and brainstorming. Facilitated discussions. I think these are wonderful. They reveal buy-in and perspective. It can be about any topic that you facilitate a discussion on. It could be counseling, it could be service, but it's about idea generation and idea sharing, getting people on the same page. Team building days were mentioned. Annual retreats. Many people like to get off WIC property and get people out of their element to plan and look at that bigger vision for driving our actions. And many of you mentioned involving staff members in the process of agency improvements. And I'm going to talk about more of some of these. There's a lot of comments on the survey about the importance of face time for leaders. And I know that there are many different models out there of how WIC programs are led and how they're set up. In some programs, the leaders can't be involved in the direct service of participants for a lot of different reasons. And in other programs, they have to be involved, especially in small programs. So I'll read you some of the quotes on the importance of being present, whatever that means to you. Be hands-on, ready to jump in, respond to emails, phone calls as quick as possible. I believe it's important to be present in clinic and see firsthand what's going on. This also allows for frequent personal check-ins with staff and shows you care. Being available physically and virtually and approachable. They themselves, meaning the leader, need to stay current in doing WIC. They need to do check-ins, no emails, of how things are going with employees. So that importance of knowing the day-to-day struggle people are going through and being there for staff. And how this looks for you is going to be very, very different depending on your agency model, the size of your agency. You'll be able to determine what works best for you. Team meetings was also another important theme on the survey. So here's a quote. Hold regular meetings where you facilitate open communication in an environment that is safe to share in a respectful way. So holding regular meetings where you facilitate that sharing. Now, what are some things to think about when planning a meeting is when do they occur? How often? Are they regular? And how often do they get canceled when things come up? So I want to do a little check-in with you now and hear about how often you do meetings. And so I'm going to do a little poll, and I'm going to read you a question and then read you the answers, and then we can vote. So the question is, how often do you have staff meetings? And the answers are daily, weekly, twice a month, monthly, every 2 months, quarterly. We don't have a set schedule for meetings, or other. So go ahead and put in your response now, and we'll see what we get for that. Okay. I'm going to go ahead and broadcast the results so we can all see. It looks like the most popular response was monthly meetings. And so that's a good, consistent way to have meetings. And it looks like there's some people who have twice a month and one that has a daily meetings. And that's interesting. I have been at programs where I've seen some sites, they do what's called a morning huddle. and that they meet quickly in the morning before clinic gets started for about 5 minutes, and they might cover what's going on for the day, or if they're all working on something together, they might kind of check in who's going to what sites and do that. And what I've seen is that seems, I've never tried it, but it seems to have worked very well for those teams and really brings them together as teams. So it's just another idea. So I want to go back and talk a little bit more about staff meetings and the questions that we want to look at when talking about staff meetings. And thinking about what's the content of staff meeting? What are you spending time on? And does it necessarily deserve face time? I had a boss in one of my jobs one time where the staff meetings was pretty much her doing the talking for the entire staff meeting. She was sharing information that, one, I wasn't really invested in, or two, could have been communicated via email. So the meetings didn't help me grow or think or share or get closer to my team in any way. So since we have such limited face time in meetings once a month, it's important and valuable to think about how we want to spend that time. And there's a lot of competing options for that time. Information sharing, facilitated discussion, we could do training or little activities during that time. There's so much possibilities that we could do, so to think about what kind of content makes sense. We also want to look at who's doing the talking. Can staff help? Can they take a role? Can they give an update or maybe do a short training on a particular topic? Can they run an exercise? And this gives staff ownership, membership, and it takes pressure off you to always be the leader of the group as well. And some of you talked about annual events that are bigger, retreats to focus on planning, face time, team building, trust, relationships. So many of you mentioned involving all staff in agency improvements, engaging them in the process. So their role is more than just serving participant after participant. They're engaged in something bigger, the creation of a successful participant-centered program that's effective, that's goal-oriented. And it helps if they're invested in it. Here are some of your quotes. Work with your team, have meetings, get opinions from all staff about changes. Be willing to try different processes, ideas that are brought up by staff. So it's interesting. It does take training sometimes. When people have a history of not being asked for their opinion, they might, or looking at that big picture, they might not be good at it. Maybe in a previous job, their ideas were discounted, they weren't acted on, and this might lead them to feel like they can't impact the situation and they shut down. But the good news is that the more people are asked to do it, the better they get at it. And can we act on the ideas that are brought up by staff? That will empower them as well. One person wrote, we've used the reflective tools to talk about what they like or would change about the way we hold clinic. I thought this was really interesting. So it's a creative way to use the tools we use with participants with staff. So again, it's all about evoking motivation and ideas, so it makes sense that the same tools can help. And one thing to remember is when we talk about engaging staff in agency improvement is to clearly define their role. Is their role to provide input into the decision, but you'll ultimately make the decision? Is it idea generation? So that or can they come to consensus and make the decision for themselves? The situation is going to determine the answer to that, but as long as you clearly give them their role in the situation. And how often you engage in the process of the planning, the agency improvements, that's up to you. It can be done yearly, quarterly, whatever you need. So one thing I've seen that is a part of building a strong team is about providing opportunities for ongoing training and mentoring. And this creates an environment of growth and learning. Someone on the survey wrote, be excited about the new tools. Present a new tool for all to try for the month so staff can feel comfortable in using it. Encourage sharing stories of successes and frustrations. And then to think about with training and mentoring, how often and when do staff receive training? There might be formal trainings from the state or from the agency. There might be opportunity for informal trainings. Maybe there's time for a facilitated discussion or a short activity at staff meetings, but it's ongoing. Thinking about, do staff receive mentoring as part of the WIC system? And I know that some of you have started implementing mentoring at your sites, a mentoring program. So I want to do another quick little poll and ask you another question. And my question to you is, do staff regularly receive mentoring sessions apart from the evaluation process? And so the answers could be yes, no, or sometimes but not on a regular basis. So let's see the responses there and take a vote. All right, I'm going to go ahead and broadcast those results. So it looks like the most popular response was sometimes but not on a regular basis, which is often what I hear from WIC programs because it takes being flexible sometimes because a lot of things come up with WIC. And keeping that mentoring as a priority is something that we continually come back to is so important. And so when working together and thinking about who does the training, who does the mentoring at your program, thinking about can you share that responsibility with other staff members as well. So it doesn't all have to be on you for training and mentoring. So many of you mentioned team building activities that you do. People talked about shared experiences, anything that brings people together to build those shared experiences. Potlucks, birthdays, after-work events, building that familiarity within the team. We talked about facilitated discussions. It can really be any topic, but it's creating that open discussion, and it's allowing different points of view to come together, making it safe. And I think facilitated discussions are often so important because we rush so much of the time. We're going from participant to participant that it's important to sit back once in a while and self-analyze and say, why do we do what we do and what's working and what's not working? Some of you mentioned videos and icebreakers are useful. You can show a little video and then discuss what it means with the team, get people's different points of view. There's videos on PCS topics. There's videos on team building topics. You could have icebreakers that are either around a topic or just to get familiar with each other. I often do one where I have people write down on an index card something about themselves that no one else knows, and during the meeting I'll go through and I'll read, and we'll all have to guess who did that on the card. Just kind of fun things to get to know each other. And there's team building activities. There's tons on the internet, and I'm sure you have some as well. I'm going to give you one example of one that I've used with success, and that's for the team itself to come up with their rules of interaction, how they want to be with each other. They want to set rules around it. It helps with team dynamics sometimes. So coming up with that shared way to be. Before so we don't get caught on reading that, I'll tell you a little bit about what I do, though, is I gather a group together, and first we do brainstorming, or if you had a giant group, you could do small groups first and then come together. But first to get out tons of ideas around how you want to interact with each other. And then kind of clumping them together, looking at areas where there's similar themes. And then you could have people vote on what they want to agree to in terms of how they want to deal with each other. I often do a little project where we put stickers and vote, and the ones with the most votes get into the rules of engagement. I'll just show you an example of what the results of one of these brainstorming sessions was. This is the list that the group came up with. It says, I pledge to communicate with each other in a positive way, show understanding, empathy, and compassion, be consistent and accountable. Everyone gets a say. Everyone is heard. Help each other grow, learn from each other. Be open to new ideas and respect everyone's opinion. Work as a team and support each other. Interact respectfully with one another in front of participants. Encourage and trust in one another. Be proactive and not reactive. So that's just an example of one possible one. And this is a different group decided that they wanted to do one around ground rules for WIC meetings instead of how to interact with each other. And I won't read all this, but it's just an example about what brainstorming that you can do and facilitated discussions that you could have. Here's some list of some resources for you around leadership and around team building. I'll read them. The Speed of Trust by Stephen Covey. This was suggested by one of you along with a corresponding workbook. The Energy Bus, Soul of Leadership, 7 Habits of Highly Effective People. That's an oldie but a goodie. The 1-Minute Manager. Switch, How to Change Things When Change is Hard. Drive, The Surprising Story About What Motivates Us. Developing the Leader Within You. And there are so many leadership and team building books out there. You can find the ones that work for you. I know in one state that the entire staff at an agency was reading the book Switch together because it's a lot about nutrition counseling and can be relatable. And then they discussed the different chapters at each staff meeting. They'd spend a couple minutes talking about the book. So I thought that was an interesting way to learn and grow together. But it's just an idea, some options for you. So to talk about my takeaways from what I got from your surveys is kind of some big takeaways was share a vision to guide and inspire others. Act as a role model. Be what you want to see. Focus on the potential for growth in everyone. A true leader will see more in me and believe more in me than I currently believe in myself. Empower others to make decisions, to have ownership, to be involved. Focus on the strengths. Set time aside for brainstorming sessions where everyone's imagination can run free, where new ideas are rewarded, where we never put down any sign of creativity and imagination, where we can involve others in the solution. It's going to lead to more investment in the team. We record goals and progress. We need to clearly define goals that are measurable. Even as gray as PCS is, it can still be measurable and we can still set goals. We want to celebrate growth and success. Every time there's a significant achievement, it creates an atmosphere of celebration. So celebrating signposts along the way to final success, it gives everybody a taste of success. And PCS is an ongoing process that doesn't really have a beginning and an end. So celebrating along the way is important. And this is a quote from John Quincy Adams. It says, "If your actions inspire people to dream more, learn more, do more, and become more, then you are a leader." All right. Well, with that, I want to thank everyone for attending today, and we will go ahead and wrap this up. So thank you and have a wonderful day.